Hello, I'm Deborah Chieli, a nationally board certified nurse practitioner with specialty certification in lifestyle medicine.
And I'm Susie Spell, a nationally board certified nurse practitioner, also certified in lifestyle medicine.
The following interview was part of a series that informed our presentation at the 2023 Annual Conference of the American College of Lifestyle Medicine, ACLM, titled Nurses in Action, How Nurses Operationalize Lifestyle Medicine in Modern Settings, and You Can Too.
In this series, nurses from diverse backgrounds and practice settings and their champions tell their personal and professional stories about discovering lifestyle medicine and how they're implementing it across a wide range of settings.
Nurses are the largest health profession in the United States and globally and have been voted the most trusted profession here in the U.S. for over 20 years. Learning about and incorporating the pillars of lifestyle medicine fosters full scope of practice and the ability to answer the call to lead by the National Academy of Medicine with their report, Future of Nursing 2020 to 2030, Charting a Path to Achieve Health Equity.
We hope these stories of success will inspire conversation and drive creative solutions to better address inequities in healthcare. Continued growth of nursing expertise in lifestyle medicine will expedite our nation's ability to address the public health emergency of chronic lifestyle diseases we currently face.
The power of nurses to create innovative solutions when combined with the practice of lifestyle medicine allows nurses to express their full potential while simultaneously addressing the salient issues of health equity, the epidemic of chronic disease, and the provision of truly patient-centered whole-person care.
When nurses are empowered to lead with an interdisciplinary and multi-sector practice, they answer the call of the National Academy of Medicine to dissolve barriers to care and improve health for themselves, the nation, and every global citizen. Enjoy the interview. Today we are talking with a doctorally prepared registered nurse, Faith Nyong. She has one of the most unique approaches to lifestyle medicine, and we are so thrilled and honored to be in this conversation with her today. She lives in the Chicago area, and that's where she lives and works. And Dr. Nyong is a faith community nurse at Ascension Mercy, where she promotes health and well-being in 15 African-American churches. And in less than 6 months, Faith's results-oriented, dynamic, and practical approach to nutrition and fitness earned her distinguished recognition. Faith continues to receive awards for outstanding health and wellness promotion services to the Hispanic and African American communities, and they include some of these following awards: the Mayoral Health Care Hero Award, the first place for the largest Chicagoland Gospel Run 5K team. I can't wait to hear more about that. The Rose Ann Poss Award, the Orchid Award, and the St. John Church Sisters of the Spirit Award. And Congressman Bill Foster also presented Faith with the Taking Back Our Community Outstanding Neighbor Award. In 2021, she was featured on a couple of news stories as well. She's really making her way into the larger community, so that's wonderful. And she even moderated the American Cancer Society's Cancer Action Network's Fireside Chat, that's a mouthful. The Black community is being left behind. Why aren't they included in clinical trials? And she's received 5 invitations from the American Cancer Society to travel to Washington, D.C. and speak with lawmakers about policies to promote access to clinical trials for cancer patients. Dr. Nyong is very clearly passionate. She's a passionate advocate for communities of color, addressing issues of inequity and increasing access to care. And her wisdom is going to serve each and every one of us, anybody that is listening to this now or in the future. And I'm really excited to talk to her and can't wait to hear more about what you're doing, Dr. Nyong. Welcome and thank you for being with us.
Thank you for having me.
So let's start with origin stories. I love to know how you got to lifestyle medicine, how you discovered it. Was it always just something that was in your fabric, or did something happen? Tell us a little bit about that.
Yeah, it's a really good question. So I have a very unique role. So the hospital has literally sends me into the community, and understanding that we can reach African Americans in African American churches. That's where my assignment is, and it's to promote health and wellness. So understanding that, and then working with community nursing and working with the health department. our local health department, I really took a deep dive into the data, into health equity data. And so that is what pushed me into lifestyle medicine, because I was faced with a really huge problem. Here where I am, African Americans live 75 years in comparison to everyone else, where the average is 81 years. And when we look at that and we break that down, we see that every 1 to 2 years, African Americans are losing over 11,000 years of life just in the town that I work in, really, due to premature death. So they're not even reaching the age of 75. So that is a big problem. And so I needed to find solutions and ways to really approach helping people, giving them the practical tools needed to live healthier lifestyles. So hence lifestyle medicine.
Right. That's amazing. I didn't know that about the loss of life, like the loss of years. That is a profound number just in your own community. Imagine our whole United States and globally. So, did you find the American College of Lifestyle Medicine in your search? How did that happen? Did you know lifestyle medicine was a thing, or did you discover that?
So I just started digging, right? And I just started looking for ways to really improve obesity, to really decrease obesity, to decrease. We have the highest hospitalizations where I live. African Americans do for diabetes, the highest hospitalizations for high blood pressure. And so it was difficult for me because I didn't really see a particular group or organization or individual other than myself in this community that was just looking at African American health, because these numbers they're egregious. And so really trying to think, how can I do this? What is the best way to do this? And just tracking down resources. And I don't know how. I'm not quite sure. To this day, it's really interesting. I got hooked up with a clinic in Rochester Lifestyle Medicine, and we started talking, and they said, we really want to help. If you have parishioners that would like to do our 15-day jumpstart, we welcome them to do that. And so I'm thinking, yeah, I have people that this would be great. And at the very same time, it was so interesting because I was in need of a new physician for myself, because I had an annual and my physician had left or insurance had changed. And so I needed a new physician. So I took the program to this physician that I did not know. And when she looked at the program and when she looked at what I needed to do, my goals at that time, my iron was low and my blood sugar had started creeping up to the pre-diabetic range. And she looked at the information and she says, you know what, I really think that you should do this because I don't know anything else that can really reverse these numbers. So it's for 15 days. Let's just see what it does. And oh my goodness, after 15 days, everything was reversed. I had perfect blood work, right? Whereas my whole family has been plagued with type 2 diabetes. Yeah, I had a cousin that was raised like a brother with me, went from bad to worse with toes being cut off, high blood pressure, kidney failure. And that is like the story of my family. My uncles, everyone has pretty much been touched by type 2 diabetes. And for me to realize that I do not have to have it, and here I am working with the largest population that is, being hospitalized for diabetes. I literally felt like I had a potion, a cure that was just as easy as nutrition and fitness. So that was huge for me.
That's amazing. I love that story. And it was so quick. It happened so fast. And I don't know if or not, but Deborah is actually affiliated with Rochester Lifestyle Medicine. So she will chime in a minute, I'm sure. Will you tell us a little bit about your specific role? Dig in a little bit more to that. Like, what does the day in the life of Dr. Nyong look like?
Yeah, so I think faith community nurse is just a wonderful role for nursing. And what it does is it puts me right where I always wanted to be. So my background is really cardiac nursery. I worked in telemetry that was where I got my start. And then I went into cardiac rehab. So cardiac was really my background. So what happened to me when I was working bedside doing telemetry, cardiac nursing, I understood the risk factors that were placing people at a higher risk for heart disease. I understood the type of patients that were getting stents and having bypass. I understood that really well. And then it was just so disheartening because I would see the same patients coming back, right? So I got to know my patients, which is unreal because you know that in working bedside, we throughput people. We really try to keep people moving and do a lot of outpatient work with them. And so having them being readmitted for the same type of heart disease and having to get additional stents, that was concerning to me. So I really wanted to dig in and really teach. I really wanted to explain to people, if you're overweight, that this is one of the things that you need to look at. If you have high blood pressure, if you have diabetes. So those were the things that I really wanted to help people make the lifestyle changes that I was asking them to make and telling them that needed to be made. I didn't have the time to do that. So then I transitioned to cardiac rehab. And that is a really unique experience because that is an outpatient exercise program. But the thing about cardiac rehab is you only qualify really to go through cardiac rehab. Literally you need a medical prescription to go through it. Your doctor has to get you into that program. But you can only do it after you've had a heart attack, after you have pulmonary disease that is requiring a lung transplant, after you've had open heart surgery. So so here's the treatment, but it's only after you've had this type of chronic disease, heart disease. So then I'm thinking to myself, wow, this is pretty incredible that really the prescription for this is exercise, and this is where we're doing the nutritional counseling. So I'd literally spend a portion of my time as a cardiac rehab nurse backing people off of medication because their heart would become more fit, it would change things, it would drop their blood sugar. That was another way that I got into lifestyle medicine. And so working as a faith community nurse, I'm able to take these experiences that I know work to help people reverse and to decrease, chronic disease. And it's amazing. So a long answer to say that I'm able to integrate the things that I've had along the way. And really, I see it working. I see people having to reduce their medicine because they're embracing these lifestyle pillars.
What great information to take into the world and into the community, which Deborah and I hear this all the time, is that we really need to get into the communities where people are living and working and playing and exercising or not. Those are really important things to do. So having that information and that knowledge, and then the additional lifestyle medicine knowledge is really powerful, as you've already described for yourself and for patients. But tell us, I'm so curious, what does your day look like? Do you go out to churches? Do you do presentations? Tell us how it all comes to life.
Where I work for Ascension Mercy, and they literally have a contract with one of the local churches here, one of the local African American churches. So my office is literally in the community. I have an office space in the community. It's really cool. And I don't only work with one African American church. I work with the surrounding African American churches, and really anybody, right, that needs health resources. I will absolutely work with, regardless as if they're African American. But we are really targeting African Americans because there's such a need. And so this gives a really great way. And the wonderful thing about it is it allows like the holistic practice of nursing, right? We know that it's not just the physical. We know that there's emotional, there's a spiritual component. And so it allows me to really work in a holistic manner that lends itself to lifestyle medicine. So it's the perfect fit when you really look at it. And then for me to be working for a faith-based organization, I tell my organization all the time, this checks every single box. So it's exciting.
It sounds really exciting. Do you have any team members with you, or is it just you? Tell us what it looks like, a team.
I really work tandem with our community health department. And I also work really closely too with the health department. Because what I do is when they do the community health improvement assessments and plans, I really take those as my initiatives, right? And it usually is that chronic disease is usually one of the top initiatives. And last year they defined nutrition, exercise, and weight management to be one of those top priorities. So that just, again, lends itself to lifestyle medicine. And so then what I do is it allows me to be able to integrate it and to bring it in. So it's allowed me to do some really cool programming around lifestyle medicine that hopefully I'll get a chance to just share with you some of the things we've been able to do.
Yes, I love that. Can you speak to for a minute? We can come back to the program. I have two things, or you can tell us maybe an example of your programming. I also would like you to speak to how you feel your very unique role is helping to address health inequities. So maybe you could tell us one, give us an example of some of the programming you do and how you interact with the community, and then follow that up with how this actually addresses inequities and access to care.
Sure. I'll give you my latest example. Okay, so a day in the life of a faith community nurse. So this past weekend, we just had a really cool event for African Americans, and I also call it lovers of African Americans. So anybody that really would like to partner and help and just really promote African American health. So it's called the Gospel Run. So this took place in the city of Chicago. So it's about an hour away from where I am. But I didn't know of any other event when I came across it that was like it. It's this inspirational physical activity event, and it's a 5K. So it encourages people to run, it encourages people to walk, and it really just encourages African American to get out there. And it's a very inspirational setting. So there's like Christian music playing over a portion of Lakeshore Drive. It just offers just this beautiful camaraderie that takes place as people are encouraging each other just to finish. And it's for a lot of people, they've never done a 5K event. So it's like a first for a lot of people. And it's a great launch into really starting your own physical activity program. So for me, it checked all the boxes. So one of the things that I did, I introduced it to the hospital, to our community health department. They gave me the go ahead. So I literally started working together African Americans in our community. And so our team was over 125 people this year. It's actually one of our smaller teams, but we're rebuilding since COVID. We did training with them over the course of this last month. We all were walking literally at the hospital setting. So it was great because it gave the hospital a chance to really do outreach and reach out and let them know that they're welcome at our hospital facility. So that was a win as well. And then it checks all the boxes as far as providing access to care, because at that event, there were vendors there. We had a table there as Ascension so that people can be hooked up to physicians and they can learn about mental health. So they had all of these vendors and displays there. And then it just really empowered individuals that if you can do this 5K today, you can walk tomorrow. This is your start. So that was really exciting. So those are the types of things. I'm really into practical. Like I said, at the bedside, I really wasn't able to spend the time and do that. And so now I'm able to walk alongside our community and really show them this is how you do it. And what's beautiful about it is that it starts to give a legacy. Because as a young person, I never saw my mom lace up her gym shoes and take me walking, or she wasn't like a tennis mom, and it wasn't anything like that. So it gives us a chance to provide something different to our children and grandchildren for them to see us exercising. So it's pretty cool.
I love that. That legacy piece is so powerful, I think. What about addressing health inequities or at-risk populations? How do you think either your work specifically or even lifestyle medicine in a broader way can help address that? Because that is one of our calls to action from the future of nursing that Deborah's going to tell us about in just a minute. Or actually, why don't I do this? Why don't I turn it over to her for a minute to talk about the Future of Nursing report and the call to actions that we've heard from that and how your work synergizes.
Thank you, Susie. And it's wonderful to share this time together here, Dr. Nyong. You're doing amazing work, and it is really reflective of the current National Academy of Medicine report and call to action, the Future of Nursing 2020 to 2030, charting a path to achieve health equity. Wanted to see if you might talk a little bit to this call to action by the National Academy and the Future of Nursing Committee, and your experience with the power of lifestyle medicine and this setting that you work in as a faith community nurse, thoughts As we in lifestyle medicine lend our particular insight, education, experience, and passion to this effort, here is one quote of many from the future of nursing. It says that nurses are trusted bridge builders who champion good health for all. The report explores how we can and must unleash the power of the nurse to achieve health equity, and how the systems nurses function within must and can do more to pay, employ, enable nurses to support them so they can do more. Wondering how you see from your vantage point there, how this can be actually actionalized. We're looking to really find ways forward in this, and it's a call to action. And I feel that we in this lifestyle medicine community are uniquely positioned with a passion to do. How do we bridge that intersection, and how do we get nurses to the place where 4 million nurses can help lead this?
Yeah, I think that one of the things that we have to do is I think that first of all, we have to introduce lifestyle medicine to nursing. And I think it's the next step. It is absolutely the next step when we think that prevention is really a nursing thing. When you look at preventative medicine and when you look at screenings, this is really something that we can own. So it's, to me, it's just a natural segue to give us this. I think lifestyle medicine gives us the tools really to really move forward and owning that preventative medicine space, preventative health space. So I think that's pretty natural. And I think that the thing for us to do is just to really begin to partner with nursing organizations, partner with the ANA, partner with these nursing organizations, and just to begin to provide the data that lifestyle medicine really has, and to introduce nurses that are stressed out, great nurses working so hard, but are not prioritizing their own health. So I think if they can see what it can do for them, as I did, and it's just so sensical. What we're doing is we're offering nutrition. We're offering a way for people to eat more fruits and vegetables, which is what we've been asking them to do. We're offering them a way for them to get more sleep and pay attention to that. And that's something that we've been asking people to do. We're offering a way for them to become more physically active. So I think that we have work within nursing to do just to introduce this to them. And I think that there'll be so much activity that's derived from that. There'll be so many nurses that are excited about just their own health. I think this is self-care. So
thank you. I think what I was hearing too is that this is the nursing paradigm, health promotion. So we, from Florence Nightingale on up, this is our space, is health promotion, helping people to be and remain healthy, to educate them. It's in our code about a patient has in the community, whoever a patient is. And for nurses, the patient can be a single individual, the community, the world has the right to be informed, make informed choices. And I think the other thing that I'm hearing from you is that it's cutting away the confusion when we partner the grounding of nurses in health promotion and an educated patient with the science of lifestyle medicine that's being codified by ACLM and thousands of studies, so that we're cutting away the confusion out there in the magazines and in the wherever someone might find it from a neighbor about, oh, just eat paleo, just eat. When we take that science and pair it, and nurses are to be evidence-based, pair it with the paradigm of nursing, and then we take the health of the nurse and the crisis that we have. And you spoke to personal experience. So it's that triad there, the personal experience of just helping nurses to experience it for themselves and see the benefits, as you did in the 15 days with the results that you got, and then being able to speak from personal experience. It sounds like we have right there a very powerful formula for.
it's exciting. It is exciting when you think what we can do. And I think that sometimes we wait and we try and we let other people take the lead, me too. And I think that this is us. And I would just really like to give nurses and really show nurses the power of lifestyle medicine. Because a lot of them are really, I was right there. I was working. It's so hard as a bedside nurse to keep up with everything and do everything in a timely manner and to provide excellent care. And so you're working so hard and giving so much of yourself that you're just hitting the break room, and whatever's there, you're just fueling yourself with that and getting back out there to be your best self and really promote health. And we're not doing it for ourselves. And I think that this is a wonderful way.
Thank you so much for that. And then, in terms of how we do this within the broader community, uniquely, you're working with a healthcare system and the local health department, which is very exciting. What do you see happening there in both of those worlds and empowered to do so, to lead? Can you share with us a little bit more about what that's like and any suggestions for that as a model moving forward for how nurses can position themselves in places to make these kinds of differences?
Sure. I think that there is a unique opportunity because I work with the health department and I'm aware of I work with them to understand the data, and especially in terms of health inequities. And I really look at this as a game changer for health inequities because we have the power to reverse diabetes, because of the power to lower blood pressure. That the group that I took through the 15-day, they were able to see it for themselves. There is the power here to really change these numbers in a radical way. Even if we just took exercise, we just got everyone exercising 5 days a week, 30 minutes a day. I think of how that would expand an individual's lifespan. So there's this really unique opportunity. And so I think my hope is that lifestyle medicine will really take a closer look at how we can then come in and work alongside our health departments to be the answer to these struggles that we're seeing within the data, because there's challenges when everything is red, and we have these numbers that are very concerning. And I think that this is the answer. I think this is a game changer. So I really hope that there's a community aspect to ACLM, if I can say, in lifestyle medicine in that way. So to really work with our health departments, and I love what they're doing in the city of New York. That is really powerful. And I think that there are counties that we can pilot some of that too. So I'm hopeful. I'm dreaming.
Thank you so much for that. May I ask one last question, and then I'd like to turn that over to Susie, and that is to just follow up on the other piece, which is, as a faith community nurse, you would share that it is very powerful and special, that how it places you within the faith community to speak in these churches and to speak with people. Can you share with us, one of the things we're hoping to do is provide a toolbox here's a toolbox for the doctors about this is what nurses can do. Here are ways to speak to a superior or supervisor about this. And so we're hoping that one of the things will come out of it will be a lot of ideas, getting certification in, of course, lifestyle medicine and other. Might we ask if you would share us how that uniquely positions you to speak to all of this?
Sure. I think that one of the things that's great about religious settings is that there are biblical imperatives, like even in scripture, about how we are to maintain ourselves, that our body is a temple. I think that working in church settings really provides some powerful motivation. For instance, one of the things that I've done is I've really taken over the season of Lent, because during Lent, there's a lot of fasting, and people are more spiritually sensitive during Lent. So I like to use that as an opportunity to really introduce whole food plant-based nutrition. Let's do a whole food plant-based fast during this time. So that's one of the things that I have done. So there's so many opportunities. One of the things I do also during the holidays, because I know that during the holidays is the highest incidence of heart attacks. During that week, yeah, from Christmas to New Year's, we see the highest incidence of heart attack. And since I know that African Americans in my community have the highest death rate for cardiovascular disease, I know that it's really important that we not go crazy, go wild, eating the wrong things during the holidays. So we do a holiday church challenge during the holidays, where we have the churches do a weight loss challenge. I call these God ideas, because who would have thought that an African American church during the holidays would be participating in a weight loss competition? So we've done it, and it's been great, because last year the health department helped me to certify the results, so they are aware. So we had over 80 people participating, a cumulative weight loss within our church during the holidays of over 350 pounds. Our biggest loser lost 23 pounds. So it was whole food, plant-based eating and encouraging exercise and encouraging these church teams. And I, again, explain to them that we're going to make Thanksgiving about being thankful. We're going to put things back into the perspectives that they are. We're going to make Christmas about the birth of Christ. And so I think that religion offers so many opportunities to come alongside and really cement these lifestyle pillars.
Wow. That is amazing stuff. I'm like, I want to do that. That's what I want to do. It sounds so fun.
Trust me, yeah. I'm a one-woman
You
team
need some
over here,
help?
so
You need
yes,
some
all
help
the
with
help is necessary.
it sounds beautiful and meaningful, because I think, just from my own experience in our healthcare system, is that people crave that meaning. If you sit, you really hear them, you really know them. Even just that is part of the healing relationship. So I think that's everything you've talked about has been so profound. I do have a couple of questions. I know we don't have much more time, but if you can speak to a couple things, I would like to know two things in particular as we come to the end of our conversation. One is, how did your health system even say, I think a faith community nurse would be really helpful? Like, how did that happen? Was it somebody of faith? Did you bring it to them? Who were the key stakeholders in that? Like, what was the genesis of that?
That's a really interesting question. So one of the things that drew me to this particular hospital was the history of it. And so what happened was that I'm really going to simplify it, but there were really several well-meaning nuns that looked at what was going on in the community as far as the poor not having access. And they started essentially the hospital. And it was really gratifying to me working in the hospital as a bedside nurse, as I actually took care of one of the nuns that our health department was named for. And they were just so humble. This was like oh my goodness, we had another one that had a PhD, and she literally would just make sure that every baby that was born in the hospital, that she went and she blessed, and she prayed with the families at every birth, after every birth. So this was just really, it just was really cool to see these women. And then for me to realize that over 100 years later, this hospital is still here. So it showed me the power of focus with women and with nursing and just what could be. So it was a part of establishment that really drew me. I'm like, wow, just a few people can really make this, and it's still here. And so about 20 years ago, one of our chaplains really worked hard to start faith community nursing, because in some of the Catholic churches, there is faith community nursing, and the Adventists have really done a really good job with faith community nursing. And so just really wanting to bring this to the community. And then I must say that this Catholic hospital, and really Catholics in general, they have a graciousness and a benevolence of giving outside of themselves. Because although this is a Catholic health system that I work for, none of the churches that I work with are Catholic churches. They're Baptist churches, they're other denominations. And so that just really speaks to me that they didn't just give to themselves, that they gave outside of themselves. And that's how this got started. And so when the position came open, it was really interesting, because I was working on a master's program when I was first asked about, would you like to do this? And I never saw myself. I'm like, I want to be like an administrator. I want to do something in leadership. And I never saw myself in this role. And things happened, and the opportunity presented itself again. And through this role, I have found so much passion, and just really being able to see the difference. It's like the difference that I was seeking when I first became a nurse. It's like I have the opportunity to do that. And it's hard for me to explain to people. And then I wanted to become the best faith community nurse. I went back and got my doctorate so I would be more evidence-based and we could do research and all of these different things. And it's interesting that I'm in this role, but it's so impactful. It's doing the work. As people told me after we did the 5K on Saturday, it is the difference. It is hope. It is, and then lifestyle medicine just seemingly miraculously coming into my life and into the practice that I'm doing. It's just been, I call
I
it a
love
God thing.
that.
So
I love it. And don't you feel this is a leadership role?
I do, but it's newer to nursing. So I'm constantly, saying because people don't know what it is. So it absolutely is a leadership role because that's the programs that I'm telling you about are programs that I didn't find anywhere. There was no toolbox for it. It was me looking at data, me looking at the population that I serve and doing lots of trial and error. So absolutely, it is a leadership role because if you're able to do it, make it work. If you're able to get 300 people to a 5K, 300 African Americans to a 5K, of course, but I guess it's non-traditional. So that's the struggle I've had with it myself, but I guess I can't walk away from it. The sheer numbers, when I look at the data, it won't allow me to walk away from it. It just won't. So I thank you guys for this discussion. It always motivates and inspires me. It keeps me thinking about the possibilities.
Right.
And
Yes.
so
And it's
please keep us in mind.
It's using your curiosity and your creativity. As a nurse, I thought, gosh, I never realized how creative and flexible and adaptive I had to really be to be a nurse. And that was a little bit surprising to me when I first started my nursing journey a long time ago. And it sounds like you're using those skills just in a different way. So I do want to know if you have some time, what has been the reaction of the community? Have you had a lot of pushback? Have you had people jumping on board right away? Do you have to convince people to come along with you? What has been their reaction to your work?
I've been really blessed. I have, because I think that people now see that when I'm talking about the data, it's not because I'm trying to say shame on you to anyone, right? I'm just trying to say, this is a situation, right? This is me. This is my aunts and uncle. This is it. These are individuals that need a little extra and we need to think about things in different ways and maybe need to look at the data and find out how has access been denied or what ways are we doing things that are turning people off or not understanding the tremendous stress that the people that I serve have. I'm going to give you a really quick story. I was doing a program and one of the individuals that was the coordinators for the program, she was telling me, I deal with some really stressed out individuals, right? And she was like, I'm stressed out. I'm like, yeah, but they're in their 60s and 70s. I'm in my early 70s. I said, yeah. I said, but it's not quite the same. I said, the individuals that I work with, they work with me because they know that they're overweight. They know that they have diabetes. They know that they have high blood pressure. They're working full-time jobs. She says, I'm working a full-time job. I said, I know. I said, but they're also primary caregivers to their grandchildren. So while they're making appointments with me, while they're coming off of their jobs, they're trying to work with me. They're trying to get kids off the school bus. They're trying to sit around the table and do homework. And they have husbands, and it's just a different type of stress when you're immersed in these statistics of also poverty. The individuals I'm talking about have the highest degree of poverty in our community. So it's different. It's like a different stressor. And then the individuals that I work with, some of the things, the trauma that has happened to the children or even to themselves when you think of domestic violence. And when you think of, I have individuals I work with that their sons have succumbed to death from gunshot wounds. And it's most things that most people don't think about. And then you're trying to be healthy yourself. So it's a little bit different. And so sometimes I think that when we unpack things and enroll things, we see that there needs to be maybe just things done in a little bit more creative way and just a little bit different empathy to understand that there's complexity. There's layers to why this data is like this. And also where I am, African Americans here have 3 times the infant mortality rate. And because the overall infant mortality rate is in the green, it's easy for it not to be addressed. And so it's things like that it's interesting when you start to unpack it and look at things. So anyway, lifestyle medicine offers so much hope. So I'm really grateful for that. But I think that I'm hoping that we can utilize it to really impact health inequities, because that is, I think when people are dying, I think when people are not living as long, I just look at that as the burning platform.
Thank you for sharing all of that. And I myself have worked in public health in a rural area with a lot of at-risk populations. And it was pretty profound to me to witness what they go through when that sense of your own physical security is threatened. If you don't have money, if you can't buy food, if you are unsafe in your neighborhood, if you're unsafe in your home, those are things that are above what some of us in a different experience have a hard time really understanding. But sometimes when you work with populations of people like that, you can start to really empathize and understand that it is, like you said, a lot different than someone like myself who might say, oh, I'm really stressed out today. It's very different.
And myself as well.
Yeah.
So yes, I agree.
Yeah.
I agree. So anyway, it just gives us a little different twist.
Yes.
Yes, go ahead.
And really important, I think, for all of us to understand some of that. The only last question, which I know we've had a lot of questions and you've shared so much with us, and we are so grateful. The last question is, anything that you want to share that we haven't asked you? Is there anything, any advice you could give for a nurse at any level, or even educators, anything that you would want to share to help somebody else go forward with this?
Yeah, I really do feel like we have covered it. I think that I really want to give the gift of lifestyle medicine to nursing. I really want to do that. And if I wasn't so wrapped up in the work that I'm doing right now, that would be my next thing, because I love nursing. I love nurses. I think that we're just a special group of people that are so relatable and work so hard and are just so bright. And yeah, I would love to give them that gift of lifestyle medicine if I could wrap that up and give that to them. So I think that would be the one thing. And I think I've pretty much talked about the wonderful opportunity that lifestyle medicine has to be a game changer in health inequities.
Yes, we agree. Of course, we're in lifestyle medicine too. And we do hear that over and over, is being able to reach more people in our profession and the health professions in general with this information, with lifestyle medicine, because it is so important. So Dr. Nyong, thank you so much for chatting with us today. And I'll let Deborah chime in for any last words. And I really appreciate you, the work you're doing, and your willingness to spend this time with us.
Thank you. I was going to ask if we had 1 or 2 more minutes. One was to just follow up on give the gift of lifestyle medicine to nurses, how you would envision that happening really in specifics, because you are creative and innovative. So I'd love to hear that, if you could share that. The second is, can you tell us, are you a part of the poster presentation in Denver for the work that you did with RLMI, and if you might share about that also.
So I'll start with the poster presentation. I did one last year with RLMI. I worked really closely with Susan, Dr. Friedman. That was wonderful. We actually just published a paper together. So that was wonderful as well. So yeah, it went really well. And then the question before that, I think you talked about how would I give this gift of lifestyle medicine to nurses. And so I think that we really do have to partner right with these nursing organizations. I think that is one of the ways. And I think that we have to start presenting this information at nursing conferences as well, at these leadership conferences. I think that we have to begin to stir in the nursing profession the hope of us really leading the preventative medicine cause. Because when we really look at it, it's nursing that is doing these screenings. It's nursing that is identifying these risk factors. And so I think that we really can really hone in on that and really utilize and show the potential that lifestyle medicine has to be a game changer. And I think also when it comes to, because I think that they did a couple of years ago, one of the big themes was nurses, healthy nurses, and self-care and all of those things. And I think that's a beautiful bundle to wrap up the gift of lifestyle medicine too, what that offers our nurses. I really do. I think that we should utilize Nurses Week to really to really do education and introducing lifestyle medicine to nurses because they do not know. I just over Juneteenth, our hospital, for the first time, we celebrated Juneteenth. And so one of the ways that I wanted to do that was by getting a lifestyle medicine physician to come in, African American, and present on nutrition and what African Americans don't know about nutrition. Not only do African Americans not know it, but our nurses, most of the population there did not know it. And so that was a great opportunity. And there was a lot of interest. But so I know that more education is needed. That was just like a one-off seminar that we did by utilizing Juneteenth. And then we had this wonderful cooking demonstration where we did whole food plant-based taste tests and so much more of that we can do. And to just really focus on nursing, to give this message and really to not just having lifestyle medicine nurses support groups, but also to introduce for those that are not familiar. That's really what I would like to engage. So
Thank you so much. And I see you so many times looking for that connection, that low hanging fruit, Juneteenth, and then into there, the holidays. Hey, we have a weight loss challenge. I just love how we can take something that's already there and then build it with this whole new twist and creativity that you bring to everything. Thank you, Dr. Nyong.